First, I'd like to thank everybody for letting me be here. We're very, very excited to be able to talk about the Recovery Ohio Early Warning Dashboard. This is something that started about about a year ago. It was in January of 2024 when the strategic initiatives for Recovery Ohio were announced. Um, they what they were in here. I'll go ahead and go to this slide. Were these seven initiatives that the governor wanted us to work toward before the end of his administration. So his administration is going to be concluding in just over or just under 2 years now. And these are the seven things that Recovery Ohio in January of 2024 really believed it could accomplish. And one of those accomplishments was to create a predictive analytics dashboard with toxicology insights. And so we've done that now. And what we have built allows people to see across Ohio by zip code what the risk of overdose is 30 days in advance. So that the model we have built, and I'll explain how it was built and give you guys a quick run through. I want to make sure we have plenty of time for some conversation, but it pulls together a series of data from across state agencies in order to train and continually train each month a analytics model for those forecasts. And so the agencies that worked on this with us are all here on the screen now. Not every agency here contributed data, but every agency here contributed a resource of one form or another. Those resources included, everything from data itself to subject matter expertise, to some of them provided some financial resources as well. So we wouldn't have been able to do this without having each of these agencies involved. So again, I mentioned that this started in January 2024. When I first presented this to the governor was really excited about it. And for those of you who have ever worked with Governor DeWine, you know that he understands that our time to our window of opportunity to have real impacts is finite. And so he really moves with some urgency. So I pitched this idea to him, and he told me I had 6 months to get it done. My immediate response to him was, "Well, I think I could get this done for you, Governor, in maybe 12 months." He goes, "No, I think you can do this in 6 months." And so, starting in January, when those initiatives were announced, we really hit the ground running. And by June of 2024, we did have a model that was developed. That model, though, it was developed, but it needed to undergo tests. I was not comfortable releasing something publicly until it had been robustly tested, and we made sure it met expectations of our team and of people who would be using it. And so for that reason, we did 3 rounds of UAT testing before we launched the dashboard publicly at all. The first round started in June of 2024, so coming up on a year ago now. With our state agency partners. Our state agency partners went through and made sure that any of the data they were contributing interacted appropriately with the dashboard and with the model itself. After we did that, we made adjustments and we released it to a couple of third parties who were invited to interact with the test model of the dashboard and see what type of expectations they had, where it might have fallen short, or what improvements they saw that we could be making. That UAT involved not only our community partners, but also our state agency partners. We took that information back, we made some adjustments again, and then we did a second set of UAT with community partners. And through all of that, we had an opportunity to monitor, of course, each month, the forecasts that were put out by the model. And what we found when we were doing that each month was that for every zip code that was forecast, over 92% of those zip codes had a forecast that was within 5, and when I say 5, that's an absolute number, within 5 of the actual target data set. And our target data set are suspected overdoses at hospital emergency department admissions. But through all of this, we had two overarching goals, and those remain our goals today. First, we want to prevent overdose deaths. And second, we want to reduce justice system involvement. For those of you who don't know me, I started my career working for the Bureau of Criminal Investigation as a forensic scientist. And since those times, taking people through tours of BCI, I've been personally saying to people that, we can't arrest our way out of this. This is our opportunity to really try and intervene at a point before which somebody is engaged or has fallen deeply into the justice system. And now what we've really tried to do is flip our opportunity to take action against substance use disorder and overdoses from a reactive approach to a proactive approach by creating those forecasts. But one of the things that I really want to hammer home for folks before I take you through the dashboard and show you how it works is what its limits are. Early on, I got this question during one of our UAT sessions. Is your expectation that if I'm in a county that has a high risk zip code and it's adjacent to a lower risk zip code, is your expectation that I immediately reallocate resources from the lower risk zip code into the higher risk zip code? And the answer to that question is no. And the reason that answer is no, and I'm going to use an analogy here again, pulling from my crime lab days. If you take something like DNA, it's the gold standard for forensic science, and you have let's say you have a cartridge casing that you found at a crime scene, and that gets submitted to a DNA lab and run against the DNA database, and there's a hit to the database. At that point, and even now we're talking about DNA again, at that point, you do not have probable cause for arrest. You don't have evidence that you can admit at trial. What you do have is an investigative lead. And this is really similar to what you have when you look at the dashboard and you see the risk classification for your zip code. It's an investigative lead. You shouldn't act on it by reallocating resources immediately. You should do an additional investigation and learn based on what you know about your community and what is actually happening in your community that may be increasing that risk, to determine which resources are available to you that can be reallocated if appropriate. So in the case of DNA, what will happen is the name of the suspect will be turned over to the detective on the case. He'll do additional surveillance, maybe follow your suspect to a restaurant where they eat on a patio, and he watches them. It's what we see on TV. The suspect, finishes his meal, gets up, walks away, leaves behind a water glass. Detective goes over, takes the water glass, puts it in an evidence bag, signs it, seals it, sends it back off to the crime lab. They run DNA on the water glass and compare that to the cartridge casing from the crime scene. Now, when there's a match after that additional investigation, then there is probable cause for arrest and there is evidence that can be admitted at trial. And in the early warning early warning dashboard, what you would want to do perhaps, and these are just examples, but if you have a deflection team, for instance, in your area or coalition in your area, maybe have somebody call emergency departments in that zip code and see if they're actually seeing increases. If you know where homeless camps are, where there are no drug houses, check in and see what people are saying. Is there a new dealer in the area? Do people suspect that there's something new in the illicit drug supply in the area? There could be any number of reasons that there is an increased risk. So do that additional investigation, and then take a scalpel to the situation and determine which precise resources then would be most appropriate to reallocate in order to mitigate risk of overdose deaths and to prevent people from being justice involved. So how are we doing this? We're doing this with the data that we see here. These are all of the data sources feeding our dashboard in its entirety. The dashboard really has three functions. I've only talked so far about the first function, and this is the primary function, the predictive analytics. I'm going to mention here the other two functions, and then I'll walk through the data sources that are contributing to the model. So the second source of, or the second function is resources to overcome barriers to treatment. And that's what you'll see at the bottom here. We're getting those data from the Dalton Foundation's freelink.org the website. They've given us their API. And these are resources from across the whole state. They're filterable, and I'll show you that in a moment, but filterable by geography. And it's really any type of resource you can think of. And the closest resource of that sort can be identified then in order to help somebody, you can refer somebody to that resource in order to help them overcome any barriers that they may have to treatment, everything from childcare to transportation to behavioral health services. That one's marked with an asterisk because it does not contribute to the model. The other data set marked with an asterisk that does not contribute to the model is our toxicology lab data. So that's under the Department of Public Safety on the left-hand side of the screen. This is the third function of the dashboard. And what this tells you is some prevalence information. So we're getting the Ohio State Highway Patrol's toxicology findings. These are findings from biological specimens that have been tested and reported by their crime lab. Just by nature of being in the patrol, most of those are OVI cases. They're not all OVI cases, and they're not all even cases from the patrol. Patrol also does testing for other law enforcement agencies as well. But this is going to be data provided by county instead of by zip code. And again, those do not feed the model. But it will give you some indication if there is a sudden change in your area of what people have taken in your area that might be contributing to an increased risk. Everything else you see on the screen now is contributing to our predictive model. So from the Department of Health, these are preliminary unintentional drug poisoning deaths. We also have the syndromic surveillance, our target data set that I mentioned earlier. It's hospital emergency department admissions. We have dispensations from ORS, our state PDMP. We also have from Job and Family Services, unemployment insurance claims, Supreme Court eviction filings. So you're noticing here that these are really kind of social determinant type data sets because we don't have a homelessness repository in the state. The eviction filings from the Supreme Court are a close second. Those are all required to be filed with the Ohio Supreme Court. And so we get that on a monthly basis from them. And then also from public safety, we have EMS naloxone distribution and suspected SUD encounters from EMS. And then finally, we have impaired driving arrests from the patrol. We're looking to make a couple of improvements, and when we have time, we're discussing at the end. I'll talk through any of the improvements that we're looking to make, and some of the progress we've made toward those improvements. So, how do you access it? You can access the dashboard in one of two ways. I have a URL up at the top left-hand corner of the screen, recoveryohio.gov/OD early warning. And then that'll take you to a desktop version. We also have a mobile version. The mobile version can be accessed by scanning the QR code. So anybody who has a phone in their hands right now is welcome to scan that QR code. This is public. It launched in January, and it's active. So you're welcome to walk through as I kind of step through the functionality of the dashboard itself. As I go through the next couple of slides, there's going to be red boxes that appear through the screen to kind of indicate what I'm referring to as I talk. But there's three ways from this screen that you can access the homepage to the dashboard. You can click the launch button, the image, or the text below. If you have questions after today and you want to go back and see, or double check something or answer a question that we didn't get addressed today, there are FAQs lower down on the webpage here. We also have a technical document over on the right-hand side that goes into a little bit more detail about the model and how our risk classification works. And then we also are going to we have our first update actually already included, providing updates to the dashboard, what that update was, why it was made, and the date it was implemented for everybody. And we'll keep that updated as we progress. But what you see here is the landing page for the dashboard, and it's that first function that relates to predictive analytics. So this is telling us here where in Ohio there is an increased risk for overdose by zip code. And again, we're looking 30 days out. When the team first started this, I told the team I didn't want people to be intimidated by numbers. I didn't want people to have to calculate or interpret numbers. So I wanted to make this easy to understand. And the way they did that was to develop 5 risk classifications. And you can see those over on the right hand of the map. So low, minor, moderate, significant, and severe. Every month, we do have some zip codes with no prediction, and those zip codes just have insufficient data. They vary from month to month, but they have insufficient data for a reliable forecast. And the reality is, no matter how many data sets we include here, no matter how sophisticated our model grows, there will always be some zip codes that don't have a forecast. And really, that's a good thing. If we're looking at social determinants, it doesn't mean that there's no risk, but it means that the risk is not more than random in that zip code based off of our model. And then this is filterable. You can, top is our 3 different tabs. That takes you to the 3 different functions of the dashboard: the risk predictions, the recovery resource locator, and then the toxicology insights for the prevalence data. And then you can also filter the map itself based off of risk classification, zip code, or county. And each of those is multi-select. If you're scrolling through the options to select, this is all run by Tableau. So you'll want to make sure that you're clicking apply in the bottom right of the dropdown. And then over on the right-hand side is the first time you see any reference to the resources that are available to overcome barriers to treatment. That menu defaults to statewide, the 5 most offered services statewide through Relink. If you select a specific zip code, it'll reshuffle those and pop up with the most offered resources. So what people are most frequently asking for in the zip code that you select also. And then down at the bottom, people are always looking for ways to access both naloxone and fentanyl test strips. We have that down there at the bottom of the screen as well. I want to take a stop. I want to pause here and just kind of step people through what I've talked about. This is usually, it's a lot of information, and a predictive model can grow complicated really quickly. So we try to boil it down to make it simple. But what we're doing is really a 2-step process. The first process, our first step in that process is to create or generate our forecast. It's going to start with, at the first of every month, we're going to have a new forecast for our zip codes. We started with 8 years worth of historical data in order to initially train the model. So that's what we started with in June. And every month since then, we've added another set of data to continue to train and educate our model. Once all of those forecasts are generated, we then move on to our second step. And here what we're looking at is we take each zip code of the forecast and we line it up against every other zip code of the forecast and we compare them. And then based off of where that zip code's forecast falls relative to every other zip code with a forecast, the zip codes receive a risk classification. One of the things that some folks have struggled with is that we've seen nationally declines in overdoses, and and that's true in Ohio as well. Ohio is really proud of the reduction in overdoses over the last couple of years. Um, but despite the fact that a zip code may have seen a reduced number of overdoses, remember what we're shooting for here. What we're looking at are the expectations for the next 30 days, right? Looking forward. So again, we're trying to be a little more proactive here. So even if your zip code has seen declines in the last couple of years, if for the next 30 days you're predicted to have more or high level of zip codes compared to every other zip code in the state, then your risk classification is going to be high. And that can be true even for those zip codes with low or with reduced overdoses over the last couple of years. So this just shows you a screenshot of a couple of zip codes in Franklin County that I've compared here. This is downtown Columbus, where my office sits, compared with an east zip code. And then over that box there, I box that in to show people. I've gotten this question a couple of times: how do I manipulate the map so that I can move it around or zoom in? And that's where you'll want to go in order to be able to do that. Moving on to the recovery resource locator. Again, you're going to default to the entire state. This is also filterable. You can filter by a specific zip code. Again, you're going to want to make sure you hit apply here. And you can also filter by a mile range. You can also filter by service type. If there's an organization that you like to work with, you could filter by that organization or the population that you're serving. And then down at the bottom, there's a yellow box around that now. Those are statewide resources that are available. Those statewide resources, 988, Expedited Pardon Project. Expedited Pardon Project is something that a lot of people who've been touched by substance use disorder may be eligible for. If there's a nonviolent criminal history, they should really take a look at this. And if enough time has passed, this is a way for their case to be triaged up to the top so that they can be pardoned and they can be eligible then for that certification that they were never able to get. I will say one of the most touching things I've done in my 20 plus years with state government has been on calls to let people know that their criminal history is being pardoned. It's a really cool project, and it's something that the governor started when he took office. But a lot of the people who would need help through the community partners on this call may be eligible here. We also offer through the Department of Insurance the opportunity to call in and help navigate your behavioral health benefits. And then again, we have naloxone access down there. But here I filtered on a Southwest Ohio zip code, and then you can filter on any number of service types. You can see I selected 3 here, and then in that area, I ended up with 68 results. And then moving on to toxicology insights. The first thing I want to mention here, again, this is all filterable and multi-select with the exception of the selected drug drop downs. I'll explain that in just a moment. The first thing I want to draw your attention to is the bar graph up at the top right-hand corner. Amphetamine, methamphetamine, and cocaine are the top 3 analytes across the state. Those are most frequently identified by the Ohio State Highway Patrol's toxicology lab. That is the case no matter what drug combination those 3 drugs appear in. They're appearing more frequently than any other drug that's reported. We did exclude THC. I do want to say that. Then that is different, though, than the table that you see below. The table you see below represents specific combinations. So that first row is really every time methamphetamine appeared with amphetamine and no other analyte in Ohio. So that's 580 times. And then cocaine appeared by itself with no other analyte 529 times. And the reason this is there like that is because one of the questions I have been getting for years is, well, if someone takes drug X, what else are they taking? Or what else might they also be in the practice of taking? And that this is designed to answer that question. So you can select up to 5 different drugs and see how many times that combination of drugs has been found and what else has been found in somebody's system when they've had that combination. So again, you can filter by county. It's multi-select, comparing Adams and Franklin here. Click apply, and then you see those 2 counties pop up. The table is going to initially appear with the aggregate for those 2 counties. If you click, sorry, here I'm clicking a couple of analytes, but the box here is what I want to show you. If you click that box, it'll expand this table, and you'll be able to see with more detail the comparison between the counties you selected. So if you select several counties, this will be an easier view for you, but you'll want to hover over the end of that arrow. I couldn't catch it in my screenshot, but a little plus sign will pop up there. And you can see it this way. I selected 2 drug analytes, methamphetamine and fentanyl-related compounds. And so what this is showing me is how many times methamphetamine and fentanyl-related compounds appeared together, and what other combinations those 2 analytes appeared with in Adams and Franklin County. All right. And so with that, I don't think I stayed within my time limit. I'm sorry, Mari. I tried to talk quickly. But I will turn it over to you to manage the rest of the meeting.